Thank you. Thank you all for coming. I'm sorry for the little bit of confusion we've experienced this morning, but welcome to our world.
Yeah.
But, you know, we are here to have our annual forum on Medicare open enrollment, and we're very fortunate to have our Shine counselor, very, very fortunate to have our Shine counselor with us.
We'll never show up here again.
You know, to talk about what open enrollment means and how it's affecting your opportunities at this time. And so Jerry will just give us a brief overview of what's happening at this time, and then we'll open up for questions, and we'll have more information as Sue Cripps joins us. But Jerry is our Shine counselor. He is serving health insurance needs of elders, trained through Elder Services of Merrimack Valley. We're very fortunate that he's with us once a month, and we schedule office hours so that people can ask health insurance questions through the year. But during this time, during open enrollment, it's a good opportunity to gain some information about, you know, how to look at your plans, what this means in terms of the opportunity to make some changes in plans or to add to what we have. So,
Without further ado.
Yes, yes. Thank you.
Is she recording now?
She is.
Okay.
That's yeah.
Okay. Hello, I'm Jerry Goldberg. I'm going to give you a brief overview of the Medicare, what it is, what it covers, and what the different types of plans that are available. Okay, and one of the reasons why we're doing this now, this time of year, is because this is the time of year that is open enrollment. Open enrollment is between October 15th to December 7th. During that time, anybody who is currently on Medicare has the ability to change their medical plan and or change their prescription drug plan if they have a separate prescription drug plan. So this is the time of year that you can change your plan. If you decide to change a plan and or a prescription drug plan during this time, those changes will not become effective until January 1. Okay? So even though you're going to possibly make a medical plan change on, we'll say November 7th, it does not become effective until January 1st, 2014. Okay, so what I'm going to do is I'm going to take going to go and give you a brief overview of what the process is, and then we'll go for questions afterwards. Okay. So basically, we have Medicare. Okay, we have Medicare A. Medicare A is basically just hospitals. Medicare A, there is no cost to the consumer. And then we have Medicare B. Medicare B is doctors, labs, things like that. There is a cost for you to have Medicare Part B. So there's Medicare Part A, which is free, covers covers hospitals. Medicare Part B costs money at the current time right now. Medicare Part B is $104.90 per month.
Coming right off your Social Security.
And usually that is taken right out of your Social Security. If you do not get Social Security, then you pay this. They send you a bill. You get sent a bill and you pay that $104.90. Now, Medicare basically only covers approximately 80% of all of the medical charges. So 80% is covered by Medicare. The remaining 20% is covered by you, the consumer. So the wise consumer looks and says, well, wait a minute now. You know, there was a $1,000 bill that I just incurred, so Medicare is paying $800, I'm responsible for $200. What you are able to do if you choose is you can buy supplemental insurance that will help cover the 20%. Depending on the supplemental insurance you cover, it may take care of all of the 20%, or it may take care of part of the 20%. So in my example of a $1,000 medical bill, we'll say Medicare is paying $800, and I'll use Ed as an example. Ed is paying $200. Well, he can have a supplemental medical plan that might pay all of the $200. Or Ed may have a supplemental medical plan that'll pay $150 out of that $200. The last $50 comes from Ed's pocket. So that's kind of how the system works. Now, I haven't said anything about prescription drugs, but I'll get there. So all I'm talking about now is doctors, labs, hospitals, surgical procedures, colonoscopy, you know, all of that type of stuff. That's what we're talking about. Okay, so this gets us down, generally speaking, now I'm going to get rid of this. So right now what I'm talking about is the options you have to pay or to help pay for that 20%. Okay, that's what we're talking about now. There's nothing you can do about the 80%, that's Medicare. So now what we're talking about are your options to take care of that 20%. We're talking about the 20% now. So there's two different ways you can go about this. You can get supplemental insurance called Medigaps. You can get supplemental insurance called Medicare Advantage plans. I hope you can read my printing. When I was a teacher, most of the students kept saying to me, I can't read what you're writing. So anyway. So there's two different ways. Remember, all we're trying to do is take care of that 20%. So there's two different ways of doing it. And like a lot of things in this country, a lot of what goes on is contingent upon money. Okay? To put it all into a nutshell, I'll explain these further in 1 second, but to put it all into a nutshell, the more you end up paying every month for your monthly premium, the less comes out of your pocket. Okay? So if you look at your financial situation and say to yourself, well, you know, I only go to the doctors a couple of times a year, I don't have a lot of medical expenses or medical bills, you can go with a less expensive medical supplement plan. Okay, but then on the other side, if you are somebody who has a lot of medical issues, goes to the doctor a lot, you may want to pay a little bit more money for a monthly supplemental plan, which will cost you less out of your pocket. I'll explain that more in a second. Okay, so we have Medigap policies. Medigap policies basically cover just about every single thing you could want to possibly have covered. Labs, doctors, everything like that. The only thing Medigaps do not cover are no drugs. Does not cover prescription drugs. In order to have a Medigap policy, you will have to have a separate prescription drug policy. So let's talk about Medigap policies. Medigap policies, there are currently 7 of them in the Commonwealth of Massachusetts. They are all regulated by the Commonwealth of Massachusetts. They basically all are required by law to cover the same exact things. Okay? The difference is that you could have a Blue Cross Blue Shield MedX, you could have a Tufts, you could have a Fallon, you could have a Harvard Pilgrim. Those are all companies that offer Medigap policies. The difference between the companies is one of money. What is your monthly charge? What they cover is required by law to be exactly the same. So one wonders, well, why is the cost monthly different? And it's all marketing. It's all the companies trying to get market share. It's all bigger companies, smaller companies, and how much they're going to charge per month. So if you were to get a Medigap policy like Blue Cross Blue Shield MedX Bronze, we'll say, okay, it might cost you $183 a month. That's your monthly premium. Remember, what we're trying to do is we're trying to take care of this 20%. So if you were to sign up for a Medigap policy, you would pay $183 a month for Blue Cross Blue Shield MedX Bronze. What that means is every time you go to the doctors, you pay nothing. Every time you have a colonoscopy, you pay nothing. Every lab test you go to, you pay nothing. If you were to go into the hospital for 5 days and have open heart surgery under this type of plan, 5 days in the hospital for open heart surgery, at the end of the 5 days, the only bill you would receive would be probably 5 days for TV rental. Everything else would be covered. Okay. However, now you realize that that is $183 a month. And realize Medigap plans do not cover drugs. So that means you need to get a separate prescription drug plan. There are different ways. Colleen can help you. I can help you. Elder Services of Merrimack Valley can help you. We can do a search on our computer, and we can come. You give us the list of all of your medications. We can do a search for you, and we can come up with 3 to 4 to 5 prescription drug plans that will cover your meds at the best possible price. So now on this side we have a Medigap policy for $183 a month. I'm going to pick a middle-of-the-road prescription drug plan, and I'll say that'll be $35 a month. So we call prescription drug plans, we call Part D. Get it? Part D, D for drugs?
Yeah.
Okay. Okay, so your total monthly bill on this side is $218. That's a Medigap policy. The example I used was Blue Cross Blue Shield MedX Bronze. A prescription drug plan, so you're paying $218 a month for your 20% coverage on this side. Okay? All right. Now you look at this and you say, "Geez, Jerry, I can't pay $218 a month. That's a lot of money." Okay? We'll go over to this side. On this side, we have Medicare Advantage plans. Medicare Advantage plans can be HMOs. They can be PPOs. Okay? 2 different types of plans. There are probably 12 to 15 different types of Medicare Advantage plans offered in Massachusetts. Medicare Advantage plans include prescription drug coverage. Okay, how do I write that? Okay, so yes to, I will put yes to Part D. So we have prescription drug plans, HMOs, PPOs, and they include prescription drug coverage. In this arena, generally speaking, every time you go to see a doctor, you will have a copay. remember, no copays, no nothing out of your pocket. On this side, something's coming out of your pocket. Okay? So you go to the doctor, you may have a copay that's anywhere from $15 to $40 to $45. You go for a blood test, you may have a charge of $5 to $20. You go for colonoscopy, you may have a $75 to $100 charge. Mammograms, $75 to $100 charge. But your monthly premium is lower than this. On these types of plans, you can have a monthly premium. Your monthly premium can be anywhere from $30 to $150. No, excuse me. $180. Those are the range of plan monthly premiums for Medicare Advantage plans, includes prescription drugs. Be aware that the lower you go here, the more you pay every time you go to the doctors. It works just the opposite. So if you were to sign up for a Medicare Advantage plan and pay approximately, we'll say $30 a month, when you go to your primary care doctor every time, you may have to pay $40 or $45.
And Jerry, is there an issue in terms of traveling, that if
People have a Medicare Advantage plan and they travel out of state. Is there,
Well, Medicare Advantage plans do not cover you if you travel out of
so
state.
that's, right,
If it's an emergency, you go to the emergency room,
Yeah.
you pay the bill, and then take that bill and send it into your Medicare Advantage plan. Over here, if you were to go, if you had a Medigap and you went to Florida,
you would
all
have-
you need to do is to find somebody, any doctor who takes Medicare,
Right.
and you're
So
covered.
The Medigap plans can travel with you. The Medicare Advantage plans.
Cannot travel with you.
So you cannot go out of state to even get a CAT
Right.
scan?
Yes, that would be correct. You're
Can
No, you can go out of state and get a CAT scan. You can go anywhere you want, do whatever
And
you
be
want.
covered by the Medicare Advantage?
No.
No, right.
The only thing that would be covered would be if you were in this Medicare Advantage plan and you were in Florida and you had a heart attack. That's an emergency. You go and you get taken care of. You get medical help.
And even then
You
can
get the
seek
bill.
reimbursement.
You pay the bill, then you take the bill and you submit it to this plan.
So
Without
if
guarantee.
I'm on a PPO and I was sent to Salem, New Hampshire for a CAT scan, that means I'm gonna have to pay for that CAT scan?
Is your doctor's office in Massachusetts?
Yeah.
though? There may, I mean, that may not.
Yeah,
be-
that's a little bit different because they referred you. They
Yeah,
sent
they
you.
did.
And they
Right,
have,
that's
that's
different.
one of their locations.
Right, that could be one of the, it could be
Yes.
it's like, could be like CVS.
yeah.
It's a chain, you know, even though, but this CVS is in New Hampshire, you could go in and you're covered under CVS. It could be the same type of thing.
Okay.
But what Jerry and I are talking about is that if you're traveling, if you're on vacation, and you require services, if you're out of state, there's an issue, and it's just so that people realize.
That's part of the difference between a Medicare Advantage and a Medigap.
Right, that's a big difference.
It is.
For some people,
For
if
some
it's,
people, it can
if
be a deal
you're,
breaker.
if you don't travel or don't, go do that kind of thing and travel, well, fine, then this may work for you. But the point I'm trying to make is the less you pay
Yeah.
per month as a premium, the more you pay when you go to the doctor.
More out of pocket.
Let's say you decide a Medicare Advantage plan and you pay $180 a month as your monthly premium. When you go to see your primary care doctor, you're only gonna pay $10. So it's a function of, the less the premium, the more out of pocket. And that's what it's a function of.
Now, on my, I wanna ask you, maybe I should wait, but some dental is covered by Medicare Advantage, and some dental is covered in my plan. Is there any dental covered in Medigaps?
Yes.
For an extra charge,
Oh, but for an extra charge?
for an extra charge.
So it's not covered,
Well, I shouldn't say this. You have to define what you mean by dental. If you were to have 4 impacted wisdom teeth taken out, well, that would be covered no matter what. That's different.
No,
But
I'm
if you
talking
have
about cleanings and bite wing.
no, in order to do that over here, you would have to have that rider put on your Medigap policy. Like
Okay.
Blue Cross Blue Shield, it might be an extra $7 or $8 a month.
Oh, that's not bad.
Well, it depends. Again, it's a function of, well, you can get one for 7, you can get one for 12, you can get one
Depends on what
for
it covers.
right. Yep.
Okay, my question was, say you were on a Medicare Advantage, you're in another state.
Yes.
You know, you have to get medical care. Do they expect you to pay the bill before they reimburse?
Yes.
Okay, out of pocket, and then they'll deal with it.
You
and
would
cut it
have
out.
to whip out the American Express or the MasterCard and right. Yes.
While you have both of those on the board, Jerry, I'm gonna just ask a question. In terms of the donut hole, Medigap, Blue Cross Blue Shield has a,
Right.
whatever it is, $2,800 or something before you
Right.
hit the donut hole. What do you do with
$2,870.
Medicare? Yeah.
Go ahead.
What's the situation? For instance, if you had a lot of drugs, on this plan, you pay that 35 or 33 or whatever it is a month. What do you do on the right if you have an exorbitant number of drugs and it costs hundreds and hundreds of dollars? With the one on the left,
With Medigap.
Medigap,
Yeah.
I'm sort of covered until I hit the donut hole. What do you do on the plan on the right?
Over here, you're sort of covered till you hit the donut hole.
Oh, so
Because
each of
each-
these plans have a donut hole?
Yeah. Oh,
Yes.
donut hole is universal.
Okay, good.
Everything here has a donut hole.
Okay.
So whether you go that way or you go this way. Now, each of these plans, Medicare Advantage plans, HMOs, PPOs, each of these plans, I said there's about a dozen of them, each of them cover prescription drugs. They all cover at different amounts. So your Lipitor might be, $4 in this plan. On this plan, it might be $8. And all of that contributes to how much Ed pays out of pocket towards
Yeah.
this. This is universal whichever way you go. Once you hit the donut hole, you hit the donut hole no matter which way you get there.
Does Blue Cross Blue Shield, I know they pay a portion of it and something comes out of your pocket, and both of those combined until it hits the donut hole. Does the same thing apply to you?
Yeah, that's federal. That's Medicare federal law.
Okay, so for whatever I'm paying now on Blue Cross Blue Shield, I would pay the same situation with.
May not be the same amount, but the same situation.
Okay.
Whatever you pay, whether it be the $2 drug here or the $6 drug here, it still goes towards counting for this.
Okay.
Okay?
Now, I
Yes.
have another question on cost. The plan for 2014 says now your generics are gonna cost $1 instead of whatever.
Yes.
Does that mean that they are paying more for the coverage that we're not paying for out of pocket? So you're gonna reach that donut hole any quicker?
No, what that probably means is if you're getting generics for $1, it probably means that they found a cheaper manufacturer to
But
make the drug
okay,
less
then, of course, you have your different tiers. And
correct.
that is the biggest concern for me,
Is tiers, right?
is the tiers.
Right.
Because if you're paying, say, you have a drug that's costing you $190 out of pocket, it's gonna drop this time to $170.
Okay.
Here, I'm really getting near that donut hole. Are they increasing the cost on the other end? Some of them don't have a generic. So this is an issue.
No, they're not increasing it at the other end. If you're getting a reduction in what you're paying for drug XYZ and it's going from 190 to 170,
Yeah.
it just means that they cut a better deal with the manufacturer.
Okay.
And they're passing the
This is
savings
what
on.
I'm really
No,
concerned
and they're
about.
passing, and again, it's what I mentioned to Ed earlier. Part of this is they cut a better deal.
Okay.
It's cheaper, but it's also marketing, because now they can say,
Absolutely.
look at how wonderful we are. We
Right.
we lowered your prescription drug coverage $20 a month.
Yeah.
And you're gonna go, oh, I love you people, thank you, and you're gonna sign up with them.
Yeah.
That's all, it's marketing.
Because that's 170, I would say, for a 3-month supply.
Right.
So, you're dealing with that. But,
So, okay, so basically, this is all the way this is the two roads you can go down remember, all we're trying to do is to take care of the 20%. Medicare's doing 80%, you're responsible for the 20%. So how do you determine which way you want to go here? Okay, the first way you go about it is money. You have to look and say, okay, am I comfortable paying $218 a month for my monthly premium? Can I afford that? Can I do that? The second big factor is comfort level. Am I willing to pay $218 a month in which I can go and see whoever I want to see and I pay nothing out of my pocket? I can go to Florida. I can. It's comfort level and cost. Well, I can't pay $200. Okay, you go over here and you say, okay, how about if I go in the middle of the road? How about if I get a policy that will say $85 a month? And that includes prescription drug coverage. Say $85, well, I can handle that, but be aware that now every time you go to the doctors, you're going to pay $25 to $30. Well, you say to me, but Jerry, I only go to the doctors once a year for my physical. Well, okay, then this type of plan at this level will work for you. If you have a wife or a spouse, we'll say you have a spouse and the spouse goes to the doctor 6 or 7 or 8 times a year and is seeing specialists and, a lot of prescription drugs, this type of plan may not work for you. The spouse may want to slide over to this side. It depends upon 3 factors. How much you can afford to pay every month, your comfort level, and your medical health. That's really what it depends on. Now, since I know we have a husband and wife here, I'm going to use them as an example. Just because Ed decides to go this way, that doesn't mean that his lovely wife Janine has to get the same policy. You can have 2 separate policies. Ed could be over here, Janine could be over here. Once you hit Medicare at age 65, you're considered a single. There's no such thing as a family plan. So what works for Janine may not work for Ed. So you have to individually sit down and say, how many times do I go to the doctors? What kind of costs am I incurring? What are my medication needs? And you do it individually. So Ed could have a whole different set of medical plan and prescription drugs than Janine. So that's kind of how you go through all of this. Yes?
I'm diabetic, so I see doctors a lot, so obviously I should go for the more expensive plan. But
Well, only if you can afford that. If you
Yeah.
can't afford that, then you have to go for the best one on this side.
but then you're paying your copay, which is another expense.
Right, but what we're saying is that if you go for example, let's say the top one here, which is $180 a month, that's your final cost. This includes prescription drug coverage. So that means that every time you go to the doctors, you'll pay, we'll say $10. Okay, so that's $180 versus $218.
Now,
I mean,
this is
you
sort of,
need to figure out what
Yeah.
works.
sort of an elementary question, but I had Harvard Pilgrim. Do they both have Medigap and the Advantage? Or is Medigap got other names and Medicare have other names?
Are there different?
Harvard Pilgrim does not, Harvard Pilgrim doesn't have anything on this side. On this side, you will have Blue Cross Blue Shield, you'll have Tufts,
United Healthcare.
and you'll have United Healthcare, AARP. That's pretty much what you'll have on this side. Tufts, I think, has about 8 plans over here. Blue Cross Blue Shield has 4, and AARP Humana, I think, has 2 on this side. Okay, over here, you have a choice of 7.
Oh, okay.
It would be Harvard Pilgrim, Blue Cross Blue Shield, Tufts, United Healthcare, Humana, AARP, that's what's on this side.
And I'm in the donut hole now, and I pay twice as much for my insulin,
Thank you.
twice as much for all my drugs. So it doesn't really matter what side
Okay,
you go on.
well, you brought up a good point, which I'll get into in a second, okay? Okay, anybody have any questions on this? Of which way, yes.
The United Healthcare, you said that's run by AARP?
Yes,
Yeah.
I guess I didn't know that.
yes.
So, but my Medicare Advantage plan, there must be more than one, because I don't have a lot of doctor visit copays, but I'll get hit by the dermatologist, the dentist, I'll get a bill a month
Right.
later,
And what's your monthly premium?
I think. It's
Next to zero, isn't it? Pretty inexpensive.
I pay something, I'm not sure what it is.
Okay.
But that's because you're with a company, your company insurance.
Yeah.
You're a Lucent.
Yeah, who covers
Yeah.
you?
Okay, okay, that's a
That's
whole
a
different,
ballgame.
Oh,
Yeah,
that's a
big
whole different
difference.
ballgame.
Okay.
Because if you are with, you know, some kind of a retirement plan, medical plan with a company, that company negotiates on their
Yeah.
own with these players. So they could be offering you as a retiree something that isn't in the general marketplace. It's
Okay.
just unique to Lucent, AT&T, whatever company it is, Raytheon. Okay, so you'll say, well, gee, I got this plan. Well, it's not here because it's unique to that company.
Then would that company have the right at some point to say, go look for another insurance because we're no longer covering you? I mean, would they do that as a mass
Well,
exodus?
it has been
I mean,
done
that's
in the
an
past.
option.
Well,
Sure.
they've changed
Yeah,
it.
it
Okay.
has been done, right?
Oh, okay.
It has been done,
About
yes,
that.
yes. Yeah,
Because they used to be, Lucent used to be Blue Cross, Blue Shield.
Yeah.
right.
Then they switched us over to Aetna. Now I'm switched over to United Healthcare and I have no say.
And
See,
what,
that's-
you have no say, the only say you have is you can vote with your feet. That's the only say you have.
True.
It's
So,
gonna cost you money.
well, all I'm saying to you is that I don't want you to just make the statement that you don't have any choice. You do have a choice. No, let me finish. You have a choice. You need to sit down and dollars and cents wise and look to see, because, for example, some people I know with Alcatel, Lucent,
Yep.
they keep raising the deductibles.
Yeah.
Yeah.
2,000, 4,000, 6,000 a year. So to sit down and to work these numbers out, for a couple of people I dealt with, it was less expensive for them to go in the marketplace and to say goodbye to Alcatel-Lucent. So you have to sit down and say, what is it costing me from the company? And how much will it cost me if I go here? And you have to work the numbers out. And if you find that it makes a significant difference, then you may want to say, I'm gonna leave, but that's your choice to make.
Thank you again for being here. I want to just take this quick opportunity to introduce Susan Cripps, who is with Elder Services of Merrimack Valley and heads up the Shine office. And Elder Services of Merrimack Valley is our local area agency on aging that provides us with support for many of our programs, including our home care programs, our meals programs, and important things such as this, health insurance counseling. So, and we'll even give you the telephone number too at the end as well. But and for people that are at home and may need some of this information and aren't unable to join us today, Kirsten and I will keep information in the office from Susan regarding the structure of Medicare, the Medicare Advantage plan guides here.
And the Medigaps.
And the Medigaps. So we'll have some of this information to follow up in the office.
Great.
Thank you so much for taking the time to come. And we still have
I'm
our
glad I
wonderful
made it.
Jerry Goldberg, our Shine counselor for Georgetown, still is hanging in with us too. So thank you both.
Oh,
This is, you know,
my pleasure, and I'm sure Jerry's too. I know I can depend on him.
I know.
I'm so
oh,
happy.
breakfast.
So, I think we were going to start to talk, Jerry was just starting to talk about the structure of Part D, which is the Medicare prescription drug coverage. And for 2013, and you can refer to one of the the pass-outs, you can see that in 2013, the Medicare Part D prescription drug plan has a deductible of $325, which basically means, just like your other insurance plans with the deductible, that once you have met that deductible, then the benefits of the plan kick in. So for 2013, the plans can have a deductible of $325, but no more than $325. Some plans have a zero deductible. Some plans have a deductible between 0 and $325. It might be $150, $175, $300, but it cannot be more than $325. For 2014, the deductible has gone down to $310. So they have to fit into the same parameters for 2014. No more than $310 for a deductible. Now, once you meet your deductible and you start to get into the benefit of the program, I'm going to give you examples of how it works. And I'm going to use a really simple example, basically because I hate math. And I find that for me this works, and I'm saying this in front of a former teacher. So, who did not teach me math, by the way. I didn't have him. I wasn't one of his students, so don't blame it on Jerry.
Okay.
Okay. After you meet the deductible, you enter what's called the initial coverage limit. So you go down to your neighborhood drugstore, and you're going to pick up a brand name drug. And the retail price for this brand name drug that we're using is $100. In the initial coverage limit, we'll say that your co-payment for that drug is 25% or $25. So you pay the co-pay, the $25 at the counter, and then the Part D plan pays the other 75% or $75. Now, to get to the $29.70, which is what is called the initial coverage limit, what you pay and what your Part D plan pays, the whole $100 is counted to reach that $29.70. So that when you go to the drugstore, you pay your copay, and your Part D plan is, let's say, in the background, paying their contribution. That whole amount, and you could think of it as the retail price of the drug, is counted towards that $29.70. Now, what happens when you get to the $29.70? Is anyone familiar with what that's called? That's right. That's called the donut hole, and that doesn't give you a gift card to go to Dunkies and get free donut holes. That means that you fall into the donut hole. You have to pay currently for 2013 and 2014. They've lowered the contribution of what you pay to 47.5%. So when you go to the drugstore to pick up that same $100 example that I used, instead of paying the $25, you would pay $47.50. And that's how the donut hole works. As we discussed, I think I mentioned a few minutes ago, that part of the Affordable Health Care Act is actually lowering the amount in the donut hole. A few years ago, it was you paid 100% of the cost of the brand names when you got into the donut hole.
Is it the same as if you're getting, say, it's not, trying to say you're on Pradaxa, okay, and you've hit the donut hole.
Okay.
The cost is prohibitive, and so is Crestor.
Right.
So will your insurance company give you the same benefit?
You pay the 47.5% once you fall into the donut hole.
Okay, while you're in the donut hole.
While you're in the donut hole, right. Did that
Well, yeah,
Yeah,
because I
okay.
was under the assumption that I was gonna be paying that entire amount of the drug.
Oh, the 100%?
Yes.
No, you pay 47.5%.
And that's a Medicare rule.
And this is the standard, right, correct, standard Medicare coverage, the way it works,
Okay.
okay? And the lady in the back had a question.
It's strange because my insulin, I take two different insulins, and one of them, they were both in the 30s. Now I'm paying 88, I paid the other day. That's
Mhm.
more than the percentage that you mentioned, isn't it?
I don't know what the retail cost is.
Yeah. I mean,
It would be 47.5% of the retail cost of each of the insulins that you take.
It just seemed, I mean, going up $50.
The insulin is quite expensive,
It's strange because
but I just don't, I don't, in my little head here, I don't know all the different costs for the different plans.
No,
But
they
that's
have
what they-
$50 out of pocket.
Yeah. Right, no, that's what
That's
they
huge.
can be charging you, is 47.5% once you get in to the donut hole. Now, once you get to another level, which is called the out-of-pocket threshold, which for this year is $4,750, then you enter or fall into what they call catastrophic coverage, and you would pay 5%, no more than 5% of the cost of that medication. So that's the Part D standard coverage. That's the way the law has written it. And I focused on 2013, but also on your sheet you'll see the figures for 2014. Since we live in Massachusetts, we're really very, very fortunate, because in Massachusetts we have access to a program that's called Prescription Advantage. And I wonder if any of you are familiar with Prescription Advantage.
Yeah.
Just go ahead, try it.
Jerry is. That's good. And what Prescription Advantage does is that it helps you when you fall into the donut hole. And I had a chart here. I'm just not having a good day today.
When you're going over the advantages, if you would, please indicate the disadvantages also of that versus having something like Blue Cross Blue Shield and get better coverage.
Prescription Advantage is a plan offered by the Commonwealth of Massachusetts to residents only. Prescription Advantage works with a Part D plan. Prescription Advantage is not a Part D plan. You could think of it as a supplement to a Part D plan. It is driven by income, okay? And I'll give you some examples. For a single person whose monthly income is at or under $2,873, and that's again on a monthly basis, or a married couple living together whose income is at or below $3,878, it does not cost you anything to join Prescription Advantage, except the stamps it will take you to mail your application to Worcester and the time it would take you to fill out the application.
The income includes Social Security income?
Yes, it does.
Okay.
What does it include?
Anything you get a 1099 for, or if you're still working a W-2. Okay? It does not count your assets. So if you had $100,000 in an IRA or $100,000 in a savings account or in your checking account, that principal, $100,000, would not be counted. The interest that you derive from that amount is counted, and you get a 1099 for it in January, I believe. So if you get a 1099 for something, that's counted as income. Disbursements from an IRA, a 401, or a 403 would be counted as income, but your savings, your principal, what you have in your IRA, 401 or 403, or stock portfolio, your asset is not counted. Okay? Now, what happens? I mentioned those figures, and I'm using the highest non-membership fee figure. If you fall into the donut hole and you're at or under the figure I gave you, instead of paying the $47.50 as I used as an example, you would pay $30, no more than $30 for a 30-day supply of that medication. So the lady in the audience who I believed mentioned that she was paying $88 as a copay for one type of insulin in the donut hole, if she were in that S4 category, she would only pay $30 for a 30-day supply of that, each of the insulins, instead of, I think you said, 88. And for you mentioned the Crestor or
Anfradex.
yes, and you said it was a very high copay. So instead of paying the high copay, you would pay, if you were in the S4 category, $30, no more than
In
30.
the S4, you're talking about that's catastrophic?
No,
Or is that
I'm
just
talking
right
about
at the
those
income?
income figures that I mentioned. Okay, so if you were in no more than, as a couple, $38.78, or as a single person, $28.73 on a monthly income, your copay for that higher drug would be no more than $30. And it might be lower depending where your income falls. Now there's another higher income allowance bracket for Prescription Advantage, which is called S5. And for this bracket, you would have to pay an annual enrollment fee of $200 per person for Prescription Advantage. And that income bracket falls between $2,874 and $4,788 for a single person on a monthly basis. And for a married couple, the income is between $3,879 and $6,463 on a monthly basis. If you have just one person in a married couple that wants to join, only one has to pay that $200 fee to join. Now it works a little bit differently in this higher income bracket. In the higher income bracket, once you pay out of your own pocket $3,355, then for the rest of the year, Prescription Advantage would pay your copays. So that in this S5 bracket, you really have to balance, unless you just like the freedom of having extra insurance, you really have to balance how much you're going to spend out of your own pocket for the medications, because the benefit doesn't kick in until you've paid until you've paid $33.55 out of your own pocket. There are at least 3 or 4 members across the Commonwealth of Prescription Advantage who are in this S5 category that I mentioned that have to pay the $200. They each take one medication that costs $11,000 a month.
Oh dear God.
So you can see why in some cases paying the $200 annual enrollment fee for Prescription Advantage is very cost effective for these folks. It doesn't have to be an $11,000 drug, it could be a $4,000 drug or a $3,000 or a $2,000. You have to, this is something where you would have to balance and see if it's cost effective for you. There are many people in that category who say, you know what, I'm going to spend the $200. My health isn't that good. I just want the security of knowing that if something happens, I have it. I'm going to get back to the lower income brackets where you don't have to pay anything. If you're here today and you say, wow, I wish I had Prescription Advantage, I've never learned of it, and I fell into the donut hole in April, and I've been paying this high cost ever since April for my medications. If you apply for Prescription Advantage today, and you get your acceptance letter, let's say sometime in November, Prescription Advantage is going to say, welcome to Prescription Advantage, Mahidabel. Your membership starts on December 1st. We want you to send us all of the explanation of benefits you have received from your Part D plan. And those are the letters that you get from your Part D plan or your Prescription Advantage plan every month telling you about your medication purchases. If you send that to Prescription Advantage, they will sit down and look at it, and they will calculate from the time you fell into the donut hole, we'll say in April, and let's say you should have been paying, you were in the S4 category, you should have been paying $30 a month for your medication instead of the lady in the audience who said she was paying $88. So she would be reimbursed the $33 extra that she paid. Prescription Advantage will go back retroactively if you're in that S4 category and calculate if you had been on Prescription Advantage starting on January 1st of this year from the time you fell into the donut hole, and they will reimburse you the difference between your Prescription Advantage membership copay and what you actually paid. They will not go back like that for the higher S5 bracket. But for the S4, if you feel that you would have been in Prescription Advantage and hit the donut hole, it's not too late to join. And you can start your application on the telephone if you call Prescription Advantage. The number is 1-800-243-4636. And you actually you do have to deal with a voice menu, but you either press the number 2 on your touchpad phone, not touch dial phone, or you say 2. Just like the old-fashioned operators, you can talk to them, and then.
But we do have the applications in the office.
Yeah, Colleen does have applications in the office, but it's just a little fast start for Prescription Advantage. They'll take your information over the phone. Sir?
Go back to the Prescription Advantage. The question I had is, if you see a lot of specialists and you have numerous doctor's appointments, ultimately you're going to be paying these upfront costs when you go in. You're not going to have that situation if you get Medigap like Blue Cross Blue Shield.
I think you're referring to Medicare
Yeah,
Advantage,
yeah.
not Prescription Advantage.
Yeah.
Yeah, Prescription Advantage is only for prescriptions,
Just
for
drugs.
medications,
Okay.
right.
Yeah.
And it will work with a Medigap or a Medicare Advantage plan. But you are addressing the co-pays with a Prescription Advantage, Medicare Advantage.
Yeah, which you really don't, you don't have that if you're paying whatever it is, 180 something a month.
If you have a Medigap,
Medigap.
if you have a Medigap plan,
Yeah.
there are comparisons that you want to make. With the Medigap plan, Supplement 1 plan especially, you do have a higher monthly premium,
Yeah.
like you mentioned, but when you go to the doctor or the hospital, use the ambulance,
No copay.
tests, no copay.
Yeah, exactly.
You have the freedom to choose the doctors that you want. If they accept Medicare, then they accept your Medigap.
But Advantage, you don't have the opportunity to select the physician that you'd like to go
With the Medicare Advantage plans, generally you're restricted to a network.
Oh, okay.
You may have with an HMO, you're restricted to a network.
Okay.
with a PPO Medicare Advantage plan, you have the opportunity to go outside of the network, maybe to someone you want to see in Boston, for example, or Salem, okay? You can go there, but you have to ask them, when you see them, will you accept XYZ PPO? And if they say yes, we will accept it, then you will pay a higher copay than you would had you stayed within the network. But it gives you the flexibility, but you do pay a higher copay for all of your services if you go out of the network with the PPO. But you have the flexibility to do that. I would urge all of you, I want to just to get back to Prescription Advantage. If you think that this is for you, Colleen has more applications. It's, especially if you're in the S4 category, up to the S4, it's a no-brainer. It's like having money in your pocket. Even if you say, you know what, I only take a couple of generics right now, I'm not going to hit the donut hole. Unfortunately, we don't know what this afternoon will bring. So things can change very rapidly. And it's just a good thing to have. And we have it. It's not going to cost you anything in most cases. Other states don't have it. It also allows you the flexibility. It gives you a special enrollment period during the year. So that if for some reason you want to change your Part D plan, you want to get into another Part D plan, membership in Prescription Advantage gives you that ability to change your plan. I've had many adult children call me and say, you know, I just visited with mom and dad over the holiday. They only have Medicare. They don't even have a drug plan. They're paying $600 a month for their medications. What can I do? If they join Prescription Advantage and are accepted into Prescription Advantage, that gives them the ability to join a Medicare Part D plan outside of the open enrollment that we're having now between October 15th and December 7th. It does not erase the penalty, but it gives them access to join a drug plan. So Prescription Advantage really gives you a lot of flexibility or advantages.
Question on that. I have a PPO which includes my prescription.
Yes.
If I want to get into a Medigap, can I get a prescription drug plan now instead of having to wait till January if I get onto prescription drugs?
Well, if for example, if you were already a member of Prescription Advantage, right now.
I'm not yet.
You're
No,
not yet,
no.
but let's say that you were.
Okay.
And today is what, the 22nd? See, I didn't even know where I was supposed to be at the moment. So today's October 22nd. And if you're a member of Prescription Advantage currently, you could actually change, enroll in a Part D plan, which because you're in a Medicare Advantage plan, enrollment in a Part D plan would terminate your membership in that Medicare Advantage plan at the end of the month. You could join a Medigap plan, so on November 1st, you'd be in a new Part D plan and on a Medigap plan because you used your special enrollment opportunity from Prescription Advantage. Right now, it being the 22nd of October, I don't think that you would be able to get your membership in Prescription Advantage as quickly as so that you could make the change by November 1st. Perhaps you would have it for a December 1st.
That would be great.
You know, but it would give you the opportunity next April if you wanted to change. You can
Yeah.
only one a year with Prescription Advantage. It gives you that one opportunity. But it would be for folks who never, especially for folks who never joined a D, they join Prescription Advantage, they can join a Part D plan at any time of the year. Or like you, if for some reason you wanted to change your Part D plan or change from XYZ HMO to ABC HMO, you could do that with Prescription Advantage, or you could join a Part D plan, get totally out of a Medicare Advantage, and in Massachusetts, pick up a Medigap, because in Massachusetts, the Medigaps have continuous open enrollment. You cannot do that in adjoining states.
Right.
So it gives you lots of flexibility. It's a terrific, terrific plan. It also, I just keep on going about it. It also limits your out-of-pocket expenses. If you're in the S4 category, which was the income categories that I mentioned, and you spend out of your own pocket $2,515 for the rest of the year, Prescription Advantage will pay your copays. You have to continue to pay your monthly premiums, but in the S4, if you reach the $2,515 out of your own pocket, they would pay your copays, medication copays, for the rest of the year. And it makes no difference if you're in a Medicare Advantage plan or a Medigap plan. Prescription Advantage will cover you for your medications.
So
Yes.
you're saying, although you have a Medigap plan, okay, and you want to apply for Prescription Advantage, that $200 a year would be a benefit.
If you're in the S5 category,
Right.
you have to pay the $200. With the S5 category, you're going to have to pay $33.55 out of your own pocket before the benefit of Prescription Advantage kicks in with your Part D plan.
Okay, because you're saying you don't know what's going to happen to your health. Right
Right.
now, I mean, probably
And
not
it
paid.
depends on how you look at insurance.
That's right, okay.
You know, everyone's different. Some people, if they had the $200 to spend it and they were healthy, they'd say, you know what, I want it. It depends on, you know, what your outlook on that would be. So, what else do we need to cover? I know Jerry did a fabulous job.
Extra help, LIS.
Extra Help, LIS. There is a federal program called Extra Help, LIS, that is available to people with a lower income that would help them to pay either all or part of your prescription drug costs. It would also give you a lower copay at the drugstore. So for someone to be eligible for that program, as a couple, your income could be no more than $1,959 on a monthly basis, and your assets are counted in this program. Could be no more than $26,500. For a single person, the amount is $1,457 for a monthly income and $13,300 in assets. So that's the guideline for that. And if you'd like an application, you can go online to ssa.gov and fill out the application, or you could also call my office at 978-946-1374, and I'd be happy to mail you the application. The yellow sheet. This is a wonderful service that we offer. If you want to fill out both sides of this and mail it to the address on the back, we will go online to the Medicare.gov website and do a search for you based upon your information, your individualized medications. We will return to you the top 3 plans that are the most cost effective for you while covering all your medications. Free and confidential service. If you would like that, I'll put them out on the front table.
And I'll keep some in the office.
And Colleen will have some in her office for anyone who likes them. We would like them in our office the Friday before Thanksgiving. because the deadline to enroll in a plan is December 7th. And last year, there were 3 of us who did probably 500 or 600 searches. So that's why we're putting a timeline on it. But please take advantage of it if you would like to do it. Any more questions? I appreciate so much Jerry filling in for me while I was misled by my calendar this morning. I did have a wonderful drive up 133. The color was beautiful. There was very little traffic, but
You needed that.
I didn't get to enjoy it as much as I would have. No stops for ice cream or anything. So thank you for having us,
Thank
Colleen.
you so much, Susan.
And thank you again, Jerry.
Welcome.
I appreciate it.
Did a good job.